Dr. Dickens Lubanga. I'm a pediatrician based in Bungoma, both at the Bungoma County Referral Hospital and Bungoma Children's Hospital in Skata. So this year, the 1st of December, we celebrate the World AIDS Day. The World AIDS Day is celebrated uh, because of the effects that HIV stroke AIDS had in our society, because most of our people uh, had really been were really dying from HIV and stroke AIDS, and also because of the myths and misconceptions that were put across by majority of the population because of this disease. And remember, currently, when HIV started, it was disastrous. Majority of the people did not know what it was, and we had quite inferior medicines that were not able to control the symptoms. So majority of the people became quite thin. Some had skin lesions that spread all over the body. Some were coughing. Some had mental issues because of diseases like meningitis. And at that time, the drugs we are using were quite expensive, way above the reach of majority of our population. But currently, as we speak, we are not seeing key trends that is happening across the country. So currently, the national average of those people living with HIV and AIDS in Kenya is 3%, which is an improvement uh, from 3 years before. 3 years before this, our rates were actually close to 5%. But remember, this has been because of better drugs that we are using. And remember, currently, we are emphasizing a concept called U is equals to U. So that means that those who are on treatment, they achieve actually undetectable viral loads. And when they achieve undetectable viral loads, then that means that they are not able to transmit the disease to their partners. And so if you use the drugs very well, according to how you have been directed by doctors, then you tend to get less complications. You tend to live a normal, healthy lifestyle and be able to contribute to the economy of the country, just like any other people. So currently, the major worries has been among the youth population because majority of the new infections are happening in the youth. That's between the age of 15 years to the age of 35 years. So remember, most of the young people are vulnerable. So in terms of their socioeconomic activities, and also they also want to experiment. Majority that age is an age for experimentation. But remember, this is the group that also people are trying to scavenge. The older people are trying to scavenge, and so we are telling them that they need to take care of themselves. They need to be cautious. Currently, we are having a widespread phenomenon whereby majority of our youth are actually having which we call intergenerational dating. So you find a 50-year-old man is dating a 20-year-old lady, and you see that gives them high chances of transmission across. But ideally, there are those that will encourage at times generational to generational dating. That's at least probably 10 years, 10 years equivalence, but not more than 10 years. But right now, you find that young girls are looking for older men because they think they have money. Probably they'll give them money and improve their lifestyles. But remember, while doing all this, then they risk their lives. And remember, this is a disease that you just get once. You engage in a sexual activity that's unprotected. You have not tested your partner, and you find that you become sick. So we are telling them that it's better to delay gratification, early gratification, or test their partners. Or for those ones who are actually positive that they are using their drugs and they're using them very well, to ensure that they do not transmit this disease to other people. Now, a rising trend again is in the mother to child transmission. So you are finding the rates have actually increased while the natural rates are going down, but new infections are happening among the young children. And this is because either one, mothers are not attending antenatal care, or for those who attend, either they fear disclosing their status to their partners, and so they end up not taking drugs, and so they end up giving birth to children with the HIV. And remember, this becomes a bit dangerous because now the child is not initiated on drugs. And remember, we are saying that even a child who is born from a mother who has got HIV/AIDS, they can actually survive without getting this disease. So there's drugs, the drugs regimen that we give them, and this ensures that they do not they do not acquire the disease from the mother. And also saying that during that time also we encourage the mother also to be taking her drugs effectively so that her viral loads are actually undetectable because that avoids reduces transmission. Remember, we are saying that even during that time we are telling mothers to continue breastfeeding as long as they are giving the babies the prevention because the babies at that time they do not have HIV. But if you do not give the prevention drug that we give from when they are born, then they stand at high chance of converting to HIV. So we tell them just continue, just like any other mother, they hold their children. So there's nothing new, and they should not fear. Uh, so we have seen cases in our community, especially in Bungoma, whereby mothers may fear disclosing to their spouse because most of the time when the mothers attend the ANC clinics, they might know their status earlier than their men spouses. So some of them may fear because of issues of gender-based violence in Bungoma. So you find that they fear being beaten, probably they'll be told you're the one who has brought the disease. And so they might not be able to inform their partners that actually I've gone to the clinic, I've been tested, and I'm actually positive. So will you also mind going to know your status, or do you know your status? Because you see, that is very important because that is the only way that you'll ensure that you do not get HIV or AIDS, and also you protect your child once they're born from acquiring HIV stroke AIDS. In Bungoma, you're also having a challenge whereby you're having a lot of teenage pregnancies. Remember, so these teenage pregnancies, remember, by the time you're pregnant, it means most likely you did not use protection at the time that you're having sex. And so most of these teenagers, they don't know much. They're lured by small gifts. And this has created higher higher levels of these mothers acquiring HIV stroke AIDS. And so it's a community initiative that we are tasking everyone because this is something that the community should be involved in so that to reduce our teenage pregnancy rates and also to educate our teenagers. The low socioeconomic status around Bungoma also compounds all this because remember, one is motivated to look for material things or money, and so this has created a case whereby it creates more vulnerability among those who have got low economic status. Remember, when you are vulnerable, this greatly exposes you. You're not able to make a choice yourself. Your choice is dependent on other external factors. But you're saying that if you empower girls, if you empower women, if you have more of our women doing income generating activities, even just planting vegetables and be able to access markets to sell them, even rearing chicken, rearing goats, having eggs, at least some income generating activities, being trained on courses, technical courses like tailoring, hair making skills. At least from there, they can earn some money that can be able to assist them meet their day-to-day needs so that they avoid over dependence on their men because You see, now when you depend on someone, then it means they're the ones to decide the game. So they're the ones to decide. You are basically at their mercy. And so that's why we encourage empowerment programs that will help our women also become more empowered. And remember, this is not difficult, because with any sexual activity, if the woman decides that you must have a condom on, then that can actually happen. So they should be able to make such kind of decision. They should not just go in bed with someone, probably close their eyes, eh, and wait it is finished. Then now they start saying they're HIV positive. So this is something that we need to empower them, that this is their body, and they need to make proper decisions regarding their bodies until when they are ready and they feel like this is the right time, or they have tested, or they know that they're negative, because this is what will help us reduce our numbers of HIV/AIDS in Bungoma County. Thank you.